so glad you're here this morning. You couldn't be at a more exciting event than this, our 18th annual AIDS Education Month Prevention Summit. Welcome. We have a list of workshops and we have a list of people like yourself and are really going to share on today. People like yourself into the synergy and to the great excitement and inspiration that we're going to receive from this great summit. But we want to begin, first of all, by welcoming our good friend, Reverend Dr. Arthur White, who's pastor of Christ Community Baptist Church. He's coming to pray the invocation prayer. Let's welcome him. He's coming to pray the invocation prayer. Let's welcome him.
Shall we pray? Gracious God, our Father, who made us all in your image and after your likeness, we bow before you this morning. We thank you for the freshness of another day and for the opportunities that are resident in this day and in this annual summit to energize us, to lift us, to empower us. We thank you for the organizers, the leaders, the supporters, the sponsors, and everyone that you've used to bring this moment to fruition. We come, our God, as proclaimers and advocates and activists. We come as sufferers and survivors. We come as workers and volunteers. We come as strategists and servants. We come as hands for well-doing, hearts for compassionate care, feet for walking in the context of others. And we've come in various roles and circumstances. We've come for compassion used feet by you walking in the context in human service. We've come in the various roles and circumstances. And we ask for your wisdom for compassion for us to know whether to by you intercede. Thank you for this wonderful day and for this empowering day. I ask it all in the name of Jesus, who showed your compassionate care and justice for all who are and were stigmatized in this day. And for his sake I pray. Amen. Amen.
Thank you, Dr. White. By the way, I'm Bishop Ernest McNear, and it is my pleasure and honor to serve today as the Master of Ceremonies. And also, it is a privilege to serve on the board of the executive board of Philadelphia Fight as the vice president. And I want to just give a commercial. Somebody said commercial. This afternoon, please be here because there's an exciting group that's going to be performing. It's the Philadelphia Fight Gospel Choir. And you don't want to miss that this afternoon. It's going to be a great climax to a wonderful day. But it is my duty at this particular time to introduce someone who really does not need introduction in this particular community. She has been a warrior with great victory and with great courage down through the years as we've been fighting this fight. She is my friend and my colleague. She is the executive director of Philadelphia Fight. Put your hands together and welcome Ms. Jamie Shaw.
Thank you, Ernest. We have a lot going on today, so in the interest of time, I'm not going to say hardly anything except thank all of you for coming, and I hope you'll take the opportunity during the day to thank all of the many volunteers and staff who worked so hard to put this event together. One thing I do want to say is we have a lot of people here. We were on the front page of the Inquirer. We hear the WHYY is going to be here to take a keynote address because it's not every day that you have the man who was cured of AIDS joining you. And I want to particularly take this opportunity to thank Timothy Brown for his willingness to come and be with us and share his story, because this gives all of us so much hope. So enjoy the day.
Jane Shaw, come on somebody. So we're going to move expeditiously, and we're so glad today that the Deputy Mayor for Health and Opportunity and the Health Commissioner for the City of Philadelphia is in the house, and here he is. Welcome, Dr. Donald F. Schwartz.
Morning, everybody. I am delighted to be here. I want to acknowledge on behalf of the mayor the continuing coordination and amazing turnout for the summit today and the coordination of AIDS Education Month by Philadelphia Fight. Jane Shaw is herself a phenomenon, and we are delighted to have Jane here in Philly and really appreciate the work that she does. Yeah, come on. I want to acknowledge Seth Williams, Philadelphia's District Attorney, who is the honorary chair for the 2012 event, and the co-chairs, Alicia Gonzalez and Bruce Herdman. And thank our speakers and visitors, both Dr. Kenyatta Gilbert and Timothy Brown, for being with us here in Philadelphia. We welcome you. Thanks for joining us. And finally, I want to just say briefly, on behalf of the city, we are standing with you in the goal of having the next generation of Philadelphians be AIDS-free. To do that, we are realigning the prevention strategy for the city with the national HIV/AIDS strategy. We have tried to be prompt in both listening and responding to what is going on nationally and what needs to go on nationally. So we are very much about reducing new HIV infections, increasing access to care, improving health outcomes for people who are infected with HIV, and very much about HIV-related new HIV infections. I have to say that in the last year, improving as we and other cities on the East Coast have pondered the reality that 50% of African American MSM over the age of 24, 50% are HIV positive. We realize that the strategies that we've undertaken to date have been incredibly important, but they haven't been effective. So, we are working hard to move testing to community venues. We're working hard to do prevention with positives, as per the National HIV/AIDS strategy. And we are working hard to engage both those who are living with HIV and AIDS and assure that they all have services, that we all are part of the solution and part of the support for people in the community who have already been infected. But we're also working hard to, as a community, identify strategies and promote the message that we can have a next generation of Philadelphians, particularly African American MSM in Philadelphia, who don't know AIDS. You all are part of that solution. You all are important partners. Thank you for being here today. And once again, thank you, Jane and Philadelphia Fight, for working and bringing us all together. Have a good day.
Thank you, Dr. Schwartz. Let's appreciate him. We certainly are grateful for the city's support of what we do in the HIV and AIDS community, in particular, what we do at Philadelphia Fight with all of our partners and all the various agencies that have joined in to make this such an exciting and significant event. We want to move forward, and at this time, it's my pleasure to present one of the co-chairs of this AIDS Education Month. Her name is Alicia Gonzalez, Executive Director of the Gay and Lesbian Latino AIDS Education Initiative. She's here to come and greet us. Let's welcome her. God bless you.
Thank you. It's a true honor to be here. I'm very humbled to be with you all today. And I want you all to give a quick shout out to yourselves. Give yourselves a round of applause for being here right now this morning. That was just so-so. Let's try it again. You guys are here, you guys are fighters, you guys are able to fight all the You deserve it, and we're going to be inspiring that sort of passion throughout the day, alright? So, gotta get started off on the right foot. I want to give a quick thanks to the AEM organizers, Juliet Fink and Daniel Moxwitz, who have done an amazing job coordinating all of these efforts. And I especially want to give a shout out to all of the providers and community members who have served on all of the committees who have brought forward this summit as well as the other summits. They do this out of the love of their heart. It goes above and beyond their call of duty, and they do it with grace and passion. It looks like we have a very exciting lineup today. Straight from a gospel choir, which I just learned we now have, which is awesome, to some really amazing workshops, right? So we have some women and girls workshops, social media, of course, and I would be remiss, and I wouldn't know my social media if I didn't mention my own workshop, which is talking about seeing pleasure in HIV prevention, so I encourage you to check that out. The workshops that we have today really do explore prevention, treatment, and justice. For today, my challenge to you is that we stay open, that we share as well as listen, that we learn as well as teach. And we must continue to look at this thing from all angles and know that there's not just one approach that works. We must continue to be innovative, work to be holistic, demand sustainability. My challenge to you is that I stay open, that we share what will take us all, just like it always has, to fight against this thing. And let today not be only a day of looking forward at what we have yet to achieve, but also a time to reflect back on all the amazing things that we have already accomplished. And know that together we can, and we must, end the epidemic. Thank you. Forward at what we have yet to achieve, but also a time to reflect back on all the amazing things we have.
Thank you, Alicia, and for the great work that you do. We're so grateful. It's time now for our keynote speaker. I want you to buckle your seatbelts, because this young man is certainly one who can tell the story and really get us inspired and revved up for a day like today, for the fight that we're in. He's a professor at Howard University. He's also an author, and he is my colleague and my friend, Dr. Kenyatta Gilbert. The Preaching Project, restoring communities through spoken word. Let's welcome him, sit near 10 doors, and receive what he has to say. Dr. Gilbert.
Good morning. Good morning. First, please allow me to express my grateful thanks to the leadership and staff of Philadelphia Fight for having me back again. This time last year, I had the great privilege to share some of my thoughts of having me back at this organization's first annual. This time last year, I had the great leaders and community summit. Some of my thoughts of having me back at this executive director, James Scholl, to President Wiles, to my friend and brother, Vice President Bishop McNear, to the Director of Education, AIDS Education Month, Coordinator, Ms. Danielle Moskowitz, as well as to Juliet Fink, the researchers, first responders, community activists, and advocacy groups, all who have gathered here today to raise the profile of the HIV/AIDS pandemic, I salute you. Indeed, I honor you who labor in the work of education and prevention. You are the sages who remind the global community that while great strides have been made in treatment, this dreadful disease has not gone away and will not die gracefully. So thanks for having me. Well, I'm a homiletician who stands in the Christian tradition. The term homiletician is a fancy way of saying I help preachers. I help ministers to develop their sermons and better say what they can and must say about God and God's active presence in the world. What are sermons? Sermons are simply life transcripts that communicate something about God and our relationship with God. But this is a keynote address. Addresses do not necessarily follow the protocols of the sermon. But you should know, you asked a preacher, a Black Baptist preacher, to use a microphone and stand behind a podium, so I can make no promises that what starts out as an address will not become a sermon. As I stated, I stand in the Christian tradition, and much of what I share today in the few moments that I have reflects my own understanding, my own faith commitments, my own normative views of my Christian confession. But our foremost concern here today transcends religious tradition, cultural strife, and our tribal allegiances. And so whatever your social location might be, ours is the common objective of naming our reality and identifying hopeful signs with regard to prevention, education, and treatment of HIV/AIDS in a world of compassion fatigue. And so I want to offer some thoughts along these lines. In an age of subject matter fatigue, I find it helpful to uproot the familiar. I want to make the bold claim to say that it does not matter, it makes no consequence that we are here today if compassion is not the driving force of our work. Here's what we know. Just over 1 million people in the United States live with human immunodeficiency virus, a lentivirus that causes acquired immunodeficiency virus syndrome. I would venture to guess that no more than half of you, if asked what HIV/AIDS stands for, could do so without hesitation. In my judgment, this is a problem, for to recover respect for what is at stake, every now and then we must give full name, full description, and not just a perfunctory label that ceases to carry weight in this time. When a person dies and we choose to say that that individual has transitioned on or has passed on or has expired, that's not the same as saying this person died fighting for his or her life. Here's what we know. We know that AIDS is incurable. We know that AIDS causes the body's immune system to fail, and that as the virus grows, it kills cells needed to support life. We know that life is not sustainable if a person's body or immune system can't fight off infection. Here's what we know. Based on what the CDC has told us, HIV is a progressive disease. It advances or worsens over time if a person is infected and neglects treatment or has no access to treatment or prevention strategy. That person's immune system will be overwhelmed and the person will die. The course is that it has not changed. First, there's a highly communicable acute infection phase, and the person develops flu-like symptoms. The second is the clinical latency period, when the virus is less active, and for up to 10 years, you may not even know that you have it. And then the last stage, death. Because the immune system is badly damaged and left vulnerable to opportunistic infections that destroy the infected person's ability to fight. Here's what we know. You can contract the virus perinatally. In other words, a mother can pass the virus on in utero in the womb, or postnatally through breast milk. Yes, you can get the virus using contaminated needles, syringes. Yes, a person can become infected by unsafe sex, variously defined. We know that each year, 56,000 new HIV cases are reported. But notwithstanding this sad fact that we live in a society where heterosexism is the perceived gold standard and where bigotry against non-heterosexual sisters and brothers reigns, here's what we know. We know that kids are engaging in hypersexual activities and throwing caution to the wind, putting their lives in danger. We know that STD rates continue to soar. We know that of all new infections, the only risk group in the United States where new HIV infections are increasing are with men who have sex with men. We know that many of our elderly who live in nursing homes are becoming infected. We know that in our overpopulated prisons, many inmates carry the virus, and when they re-enter the society, they infect their wives and partners if they haven't been tested. Sometimes they know that they are positive, yet refusing to care about themselves or anyone else. We know that since discovered 30 years ago, after claiming 25 million lives, 18 million orphans later, in Africa, of the 312 million people in the United States, where black people make up 43 million of the 312, half of the people who contract the virus that causes the deathly syndrome are black people. That is a problem. We know that blacks are disproportionately affected by HIV infection, that black men who look like me are 6 times more likely to be infected than my white brothers, nearly 3 times as likely to be infected than my Hispanic Latino brothers. We know that black and Latino women are at much higher risk in getting HIV than their white women counterparts. We know that socioeconomic station and economic disparity and poverty are major factors contributing to barriers to prevention and treatment. We know that the Commonwealth of Pennsylvania ranks the 7th highest of our states of the reported cases of AIDS, and that the city of Philadelphia is one of the 6 major cities with the highest rates, 5 times that of the national average. Here's what we know. We know that if you don't have sex at all, if you only have sex in a mutually monogamous relationship in which both partners test negative, or if you use a condom properly each time you have sex, or if needles aren't shared, the risk of infection is greatly reduced. However, to state the ideas of risk reduction gets us nowhere. We're not willing to name our reality. We know this. Our elected officials know this. Our religious leaders know this, but are far too busy, far too hands-off, and far too silent about it. AIDS is an affliction that affects the whole human family, a condition in which we all participate. But here's what you may know or may not know. For every human condition or malady that puts our lives at risk, there is a favorable divine response. But we must take care to name the crisis for what it is in order to deal with it. Name human suffering as a time that we live in, where social hemorrhaging has greatly increased and has caused us to suffer from compassion fatigue. Or to say it another way, we live in a society short on genuine love for the other. In the book of 1 Corinthians, chapter 13 of the New Testament of the Christian Scriptures, the author Paul, addressing a bickering, bitterly divided church community, places special emphasis on unconditional love as essential to unity. He accents love's attributes by naming what love is not. Love does not make noise. Love is not taken by flattery. Love never boasts. And love is neither arrogant nor pushy. But this is what love is. Paul says, love is patient. And love is kind. Love is truth-seeking. Love is unending. It is other-centered. It is unbound. It is unbroken. Martin Luther King Jr. suggested that love is created because it resists aiming arrows at any individual. That is why evil systems are the enemy love seeks to defeat. In other words, love's goal is to find some element of good in the human person, because human redemption is always love's highest ideal. Now, some folks are already exceptionally burdened by their infirmities and by their environment. So the last thing our sisters and brothers need is someone to point their finger or to stand in judgment of them in the court of human opinion. For as I see it, I say this primarily to my Christian brothers and sisters. To be an authentic Christian, as I interpret Scripture, is to know that love carries a priestly responsibility, which says the strong must bear the infirmities of the weak. Love that matters is justice-seeking. It says that members of our nation's less burdened classes should be called upon first to accept the risk of social death and ostracism that come from standing with those who have been pushed to the margins. Love seeks justice and names things unfair when the more economically and educationally advantaged members of our society are the likeliest to be the biggest recipients of the best of medical care, while the poor with limited access to the best care are deprived, but first looked to as preferred research subjects in clinical trials that may subject them to great harm. Research to say we care about those who suffer with AIDS means we must name it as and subject them to great harm. The whole human family. To say we care about those, or to name it, is to raise corporate concern about what it means to stand in solidarity with victims. As to know, as the critical social theorist Matthew Lamb puts it, we must ground our political ideologies and theologies in the conviction that the cries of the victims, or the vox victimarum vox Dei, the cries of the victim is really the cry of God. And that the scandal of the cross is the scandal of God choosing to be identified with all the victims of history in his passion, and that Christ's identification was not passive acceptance of suffering, but overcoming the forces of evil and death through the power of his resurrection. To name reality through this prism is to clearly articulate what it means to act justly in the here and now. But more specifically, it means that we must never grow weary of enabling people to understand their lot, to see the transitory or ephemeral nature of life for us all. see our life situations in light of the justice of God and what God intends for us to be and do in an unjust and violent society. To name our reality is to name the fact that God's unconditional love is a self-transcending love that breaks the hold of bias on the human heart and mind, asking us to be genuine in standing in solidarity with the victims of HIV/AIDS, not to trivialize their sufferings or mute their cries that make their claim on our consciences, not to be contented or claim victory won because we know that great strides in medicine have been made, have been proven, and have proved to prolong life for those who are infected and get treatment. To be genuine in standing in solidarity is to recognize that love cannot be genuine love if it seeks to distance itself from the histories of suffering of our brothers and sisters who carry the virus in their own bodies. Now, I teach homiletics, which is a fancy way of saying I teach preachers, at a historically black university-based theological institution in our nation's capital. Each semester I give a tone-setting talk to students who file into my introductory preaching course. Some of them come with modest concern for preaching. Most of them come with how-to expectations, on the hunt for tips to cram into their homiletical toolboxes. Still others are present with hopes of conquering fright of public speaking and simply to complete the course with a good grade to show for it. For good or bad, accompanying the person is always the stuff of their lives, personal baggage, narrow theological views, prejudices, is always long-cherished assumptions of what they think makes for good personal baggage. But this year was different. What set the tone this year was the presence of a gentleman sitting in silence, listening on intently with his oxygen tank stationed on the floor at his side. With his nasal cannula affixed to his nostrils, he set the tone. For his presence reminded each of us who had gathered there that you cannot preach a gospel you don't believe. You cannot preach a gospel that you are not committed to. And you can't preach to those for whom you have no compassion. Never before have I seen so much vitriol in the public debate over issues surrounding sexual orientation, same-sex marriage, who gets to legislate and shape policy regarding these matters. It seems that we in this country have been so preoccupied about being on the right side of the debate, whatever that side is, and have not discerned humanity's deepest need, and that is to know love, to find justice, and receive mercy. And so this gentleman became the gospel for us without words. A few weeks into the semester, I received an email that was sent to all of the gentleman's professors, informing them that he had checked into the hospital to please make provision for him to make up any missed assignments. I received a call from him, and this is what he said. He said, I want to learn how to preach. I know God has called me to ministry. I need you to help prepare me. I hate to miss your class, but I promise I will stay read up and I will study. Just before paying him a surprise visit at the hospital, not really knowing much about his critical state at that time, not even knowing that he was HIV positive. not knowing that he had started seminary 5 years ago, only to have his studies disrupted. And now here again, his studies are being disrupted. He was barely able to talk. His breathing was labored and he looked weak and fragile, but at the foot of his bed were all of the textbooks that I required. He reminded me then and there that the gospel can be preached without words. He was committed to staying on task. He is a man not afraid to die lying before me, but more afraid that he would miss his day to preach. He didn't want to miss the opportunity because of this setback. He wanted to make sure he got the mechanics, but he had no clue that he was the gospel. No clue that the gospel was being preached through his life. The 15 students that enrolled in that course, only one of them students that enrolled in that course. Only one of them. These are they who filed into my classroom on the hunt for sermon tips, trying to overcome their fright of public speaking. And here and there they missed their opportunity to experience the gospel. Training for ministry, missing the gospel. God spoke to me and said, watch him carefully. That was the inaudible word God had spoken to me. Watch him carefully. Sitting there with a stigma he cannot shake, a setback he cannot manage at best. He can only manage at best, but ultimately will not overcome. An unshakable condition kept at bay because he is disciplined, because he has support, because someone loves him, because he has a strong faith. Then and there, God said to me, and I usually don't talk that way, watch him carefully. He has something to teach us. He will teach you how to live. He will teach you how to love. He will teach you to live as if you were dying. To use the words of Anne Lamont, he's here to teach you how to live as if you were dying, so that you may have the opportunity to experience some real presence. Now, you will attend workshops and sit in on many presentations today. You will have many resources from which to draw insights and guidance for your work. Yours is not an easy task. I'm no medical expert. I haven't spent a day in the lab. I made a C in high school chemistry. But I am clear about what my task has been this morning, to simply remind you of the spirit in which you can, you should, and must go about doing your work. You are here to answer compassion fatigue with your alertness to the fact that all people have the right to respect. To let the world know that there is no justice without beneficence. To answer with our lives that genuine love means to stand in solidarity with those who suffer from this disease that has not gone away and that will not die gracefully. This is how we respond. We locate and we listen. We deplore intolerance and bigotry. We stay in conversation with medical professionals about the clinical realities and new treatment options. We who are clergy, we don't huddle to fight against people. We huddle to collaborate and to discuss our hermeneutical strategies, to talk about what unsettles us. We promote and preach prevention, get tested, get treated, get involved. We seek to know all sides of the debate, resist being so rigid and dogmatic, and we respond with decency. We visit hospitals. We even go through the testing procedure. If we've only had one partner or no partner at all, we sit in the waiting room before and after the test and wait there, if for nothing else but to imagine what it feels like to be afraid that you will get a report that you are HIV positive. I guess I've tried to say too much. Perhaps you hold the opinion that I've said too little. All I've tried to help us to see is that compassion is our common language, and that we must name the hard reality that each of our lives are at risk in this crisis if we turn a blind eye. If we turn a blind eye, we must own the fact that we have failed and dishonor God's greatest gift and God's greatest expectation of each of us, and that is to love without condition. How can we be happy in heaven if we've left our brother or sister in hell? He sat quietly with his oxygen tank at his side, with his nasal cannula affixed to his nostrils, pen in hand, taking notes, contented to hear my tone-setting talk that opening day. Then God spoke to me and said, watch him carefully. He will set the tone. He's not just here to learn about how to craft a sermon. He is the sermon. He has come to teach you and your students how to live as if you were dying, so that you might have the opportunity to experience some real presence. Thank you.
I told you to put on the seatbelt. You know, it's one thing when you hear a good preacher, and you are a preacher, you get one of two feelings. You either want to preach some more, or you want to preach yourself. And certainly, Dr. Gilbert has given us a word today. Challenge us all, brought it right down to earth. For regardless of what faith you have or no faith at all, we are all part of this humanity that cries out for compassion in this day and time. I'm so glad that I was here, and I'm glad that you're here today. And thank God for everyone, and thank you, Dr. Gilbert. This is now really a great honor for me to do what I'm about to do. We're going to be looking at and facing the move, I believe, the move of God and humanity together, and all of us just seeing it come just alive, the actualization of our efforts, and as we all have partnered together, regardless of what our particular activities have been. It gives me great pleasure and an honor to present to you and to introduce to you the man who was called the Berlin Patient. He is the one who sets the tone.
All right.
He's setting the tone for our meeting today. Welcome, Timothy Brown.
Unfortunately, I'm not a Black Baptist preacher. I hope I can still keep your attention. My mother named me Timothy Ray Brown. The media renamed me the Berlin Patient. I am the man who was had HIV. My mother named me. I don't think this came as an empty boast. To be honest, I don't think I fully believed it until the New England Journal of Medicine published the case report about me in February of 2009, almost 2 years after I got cured. There's nothing like having a respected medical journal talking about you to drive home a point. Since being cured, I've mostly gone on quietly with my life. Some of you might think I would have shouted it from the rooftops. I've always been a pretty private person, so I was initially satisfied with just being cured. It wasn't until I looked at the bigger picture that I realized that I had to tell my story. By sharing it, I hope that I can bring some new hope and optimism to the fight against HIV. So how does a man from Seattle, Washington, come to be identified with a medical milestone half a world away from his birthplace? I was attending school in Berlin in 1995 when I tested positive for HIV. My reaction was like that of many others who were diagnosed at the time. I was terrified. I knew many people who were struggling with the disease. Some of my friends had already died from it. I don't think I'd ever felt as alone as I did at that moment. It didn't help matters that a friend of mine told me that I probably only had a couple of years to live. He actually was the person that suggested I get tested because he had tested positive and he said I should go get tested, and I did, and I was tested positive as well. At the time, most of us viewed an HIV diagnosis as a death sentence. Cure was not a topic for discussion. I just wanted to survive. If you are familiar with the history of HIV, you know that the following year brought a new treatment that started to hold the disease in check for many of us. Combination antiretroviral therapy seemed like a miracle in 1996. Really sick people got better, people looked healthier. Over time we realized that many of us were living longer. I knew that I had a deadly disease, but death didn't hover quite so near. I came to believe that I would remain healthy and live a pretty normal life. The next 11 years were pretty uneventful. Germany's universal healthcare system provided me treatment that most people in the world didn't have. I was also lucky that I mostly tolerated my HIV medications. I got used to the idea of a lifetime of pills. The clinics in Berlin allowed me to move HIV to a back burner. My story became commonplace for an HIV patient with access to health care. And unfortunately, that isn't always the case in the United States. And I hope that will change. And I'm fighting for that. Anyway, I'm going to speak to Congress and members of the Obama administration next week. I'm going to speak to Congress and they'll listen to me on administration next week. I'll promote a cure for HIV. It wasn't until 2006 when progressive therapy resulted in a referral to an oncologist. A bone marrow biopsy showed that I had acute myeloid leukemia. You didn't have to be a specialist to know that that was bad news. Before I could spend much time wrestling with my mortality, again, I was admitted to the University Hospital under the care of oncologist Dr. Gary Luger, who started me on standard chemotherapy. Chemotherapy reminded me that treatment for a deadly disease can be miserable. It mocked me. What? Protease inhibitors upset your tummy once? Well, get a load of this. I developed pneumonia early on. I had to start my third round of chemo halfway through when I developed sepsis. I could have died. Fortunately, I had some great doctors. I was released from hospital. My leukemia appeared to be in remission. but there was concern because I hadn't been able to complete all of the chemotherapy. Dr. Huger recommended a little vacation after my treatment, so I took off to Italy. The museums and beaches of Genoa were just what the doctor ordered. In addition to providing excellent advice, Dr. Huger had a revolutionary treatment idea. He was aware of the discussions going on in HIV research about something called a CCR5 receptor mutation. The CCR5 receptor allows the HIV virus to attach to the T cells and subsequently infect the cell, spreading the disease. People without CCR5 appeared resistant to HIV infection, but they are rare. Only 1% of the Northern European population is this lucky. Unfortunately, I've seen the data dividing up areas of the world, and it looks like only Europe has these. I've seen the data dividing up areas of the world, and that is very sad because I care about people in Africa, in Latin America, in Asia, and but I hope that what comes about as a cure that's more readily available. I wouldn't wish what I went through on my worst enemy. Yeah, because it was awful. So I'm hoping that a cure, if it comes about, it'll come about. I hope that it'll be applicable to all of the world. So why am I telling you this? Well, another treatment for leukemia would be to wipe out the cancer's immune system and replace it with healthy stem cells from a donor. Dr. Huger thought if a stem cell transplant was necessary, why not use a compatible donor who had the CCR5 mutation? The idea was that if my cancerous HIV susceptible immune system was replaced with an HIV resistant line of cells, not only would my leukemia be treated, but HIV might be cleared from my body. I thought, a possibility to be rid of cancer and HIV at the same time? Who could say no to the chance to strike back a disease that had killed some of my closest friends? Who could say no to be a part of something so groundbreaking? Who could say no? Me, that's who. I said no. Some of you, so let me put this into perspective. When this was first proposed to me by one of Dr. Huger's colleagues, I was recovering from chemotherapy. I had come close to dying. By comparison, my 11 years of HIV treatments had been a cakewalk. And stem cell treatments are very risky procedures. Did I really have to go through this extra hell? Some might call me a difficult patient. That's not true. I usually follow my doctor's advice. Remember, I did go to Italy. In January of 2007, my leukemia returned. Initial attempts at a different chemotherapy were not successful. A stem cell treatment became a viable option. Dr. Huger screened 67 patients before he had a compatible donor who had the CCR5 mutation. I evidently had 262 donors that matched my HLA type, and because of that, Dr. Huger had the remarkable idea to look for a CCR5 donor, CCR5 negative donor, and found one after the 67th try. I want to point out that that wouldn't have happened in the United States because of the way that money is given for treatment of leukemia and other potentially dangerous diseases. Because in the United States, if somebody had the idea that Dr. Huger had, they would have sent it to. They would have asked the insurance company that would have possibly given 2 tests of test for the CCR5 negative people. It took Dr. Peter 67 tries to find one for me. So that's one thing I want to tell Congress and the environment. The healthcare system in the United States is not working. And I want to change. I want that to change. Okay. I underwent total body irradiation to wipe out my body's immune system before receiving the transplant. I took my last HIV medications on the day of my stem cell transplant. The result, there was no detectable HIV in my system after 3 months. It was gone. HIV was gone. My T cells increased. I thrived. I went to the gym. With HIV, I had developed wasting syndrome. Without HIV, I had developed muscles. I was looking good. I felt good. Until 2008, when my leukemia returned. Not my HIV. 7 months after my stem cell transplant, off HIV medications, and I was still without detectable disease. Well, the HIV anyway. In February of 2008, I underwent a second stem cell transplant from the same donor. My recovery from the second stem cell transplant was complicated. I became delirious. I had to have a brain biopsy done. I've been left with some neurological problems that require ongoing care. My life is far from perfect, but it's still my life. It is now 5 years after my first stem cell transplant. I'm still without leukemia, but that's not the reason why you are listening to me today. It is that after 5 years without HIV medications, I still have no trace of HIV in my body. I've been poked in biopsies. I have been poked in biopsies from head to toe. Samples have been taken from my spinal fluid, anal mucosa, and any other place doctors can think to stick a needle. But no virus anywhere. To quote Dr. Peter in the December 2nd, 2010 issue of the medical journal Blood, and he's talking about me, it is reasonable to conclude that the cure of HIV infection has been achieved in this patient. Cure. After 30 years of dealing with a disease that has killed more than 34 million women, children, and men, somebody in the medical community said it. Hell, published it. Here, not in a it would be great someday if sort of way. He meant today. Now I know my treatment is not about to become a commonplace procedure for HIV, to cure HIV. It is dangerous. It is expensive. But my experience has shown that cure is possible. After all, I am not an abstract concept. I know that we have not yet achieved our next phase of miracles with HIV, a readily available cure. But there are more researchers now who are willing to focus on a cure rather than just treatment. My experience has also shown me the benefit of an effective public health system and the synergy it can achieve working with academic medicine. I applaud those of you in the medical field for your dedication and hard work. I encourage you to continue to think outside the box. Remember that a former infectious disease patient is speaking to you today because an oncologist had an idea about treating HIV. For those who are burdened by cynicism or battle fatigue from their long fight against HIV, I hope that my experience brings a renewed optimism. As I finish, I would like to share my dream with you. My dream is not to be the man standing before you and saying, I am cured, but to be the man who stands before you and says, we are cured. Thank you for having me here today.
Oh, come on, you can do better than that. Isn't that a wonderful result? Yes, thank you. Timothy Brown, thank you so very much for sharing with us. Thank you for all that you went through and going through it, believing. Amen. I'm so glad. I just feel like this is just what it's all talking about. This is what it's really all about. That there is a cure. I was saying at the faith summit the other day, there's nothing too hard for God. And God uses people. Oh, come on, son. God uses people. It's wonderful. It's wonderful to see how all of us can come together and do what we are called to do. And that is, as Dr. Gilbert said today, that we, the strong, should bear the infirmities of the weak. And I just believe that this is going to be, I believe that we are all going to be able to say this, that we are cured. Matter of fact, let's practice. Say we are cured. Come on, say we are cured. Come on, put those hands. I tell you, this was worth the journey this morning. And now, as we come to the end of this particular portion, it's my good pleasure to present a wonderful lady. She is so tremendous. Year after year, she heads up education department of Philadelphia Fight. She is the one who really just put all the spokes and everything together. She's a tremendous lady. Let's receive Juliet Fink.
All right, I'm going to also keep it really short and brief. But good morning. Good morning. Good morning. Welcome to the 13th Annual Prevention and Outreach Summit. So thank you to the Reverend Dr. Arthur White, Bishop McNear, whose work we could not do what we do without him, Health Commissioner Don Schwartz, of course Jane Shull, our two AEM co-chairs, Alicia Gonzalez and Bruce Kerman, and our just phenomenal keynote speakers, Dr. Kenyatta Gilbert and Timothy Brown. They started us off right, and they are energizing us today. This year's Prevention Summit should have a little something for everyone. There are 13 different tracks, 36 different workshops today with over 100 speakers. This summit could not have happened without the many dedicated planning committee members who often went above and beyond to find speakers and create workshops. They are a phenomenal group of individuals who provide critical services in our community for people living with HIV and AIDS and those at high risk every single day. And on top of that, they spent every other week with me at Philadelphia Fight brainstorming workshop ideas and speakers. The quality and strength of this summit is due to them, and so if they're in this audience, I just want you all to stand up and just be recognized. I also want to thank the many volunteers who are here helping with registration, greeting people, and handing out evaluations this year. We could not do it without them. And in particular, I would like to thank those who were here at 7 a.m. and those who will be here to pack everything up at the end of the day. And in particular, I must say a very, very strong thank you to Danielle Moskowitz and Tina Radin, who were the two people who stood beside me and made this all happen, and who printed programs, and who organized everything, and who helped me this year really put it on. I would also like to thank our sponsors, without whose help we could not put on this summit year after year. So with so many workshops this year, please read the program carefully. You'll see a chart of workshops by track and then the descriptions listed in the program later on. Not sure where to start? If this is your first time to the conference and you feel like you don't know very much about HIV and STDs, start at HIV 101. Do you really know all the facts? We want to make sure that you get off on the right foot today. But there's also some additional non-workshop related activities here. So thanks goes out to the AIDS Fund, who brought us pieces of the AIDS Memorial Quilt, a powerful visual reminder of the AIDS pandemic. With more than 47,000 individual 3x6 panels, the quilt serves as both a memorial for those who have died as a result of AIDS complications and to help people understand the devastating impact of the disease. We also have, you may have noticed, the 1981 until it's over timeline of the past 30 years of the HIV and AIDS epidemic. And the timeline serves as a reminder of the progress we've made since the start of the epidemic and emphasizes the continued need to fight the disease in our community. But we wanted to have another way to express our collective thoughts this year as well. So in room 126B, remember that room, 126B, our Critical Path team will be filming individuals who wish to reflect on the past 31 years of the AIDS epidemic and how we can, given what you've heard today so far, end the epidemic before the next 10 years are out. This will take place from 11:45 to 1 p.m. and then again after lunch from 2:30 to 3:45 p.m. If you would like to be filmed, please stop by room 126B and have your voice heard, because it will take all of our collective voices to end the epidemic. At the end of the day at 3:45, we have a place to cool down. For those who wish to relax, breathe deeply, you can go to our relaxation space in room 124, where we have a yoga instructor who will lead you through some very simple exercises, nothing complicated, I promise. But for those who want to get hyped, we will have a performance right here in this room at 3:45 p.m. by the Fight Gospel Choir, and a legendary dance-off between two extraordinary prevention programs with a long history of friendly competition, the Attic and YHAP. We want you to get ready for our Saturday event, Antidote, which will be an epic B-boy, B-girl battleground and dance-off to raise awareness of HIV among young people. This year, like in years past, we will also be raffling off some prizes, but as many of you who have come to the summit before know, there is a catch. In order to enter the raffle, you will have to stop by the condom demonstration tables and show us that you actually know how to put on a condom correctly. That's right, because until there is a cure for everyone, we need to make sure that everyone knows how to use a condom correctly and consistently. We will hand out small prizes during lunch, but we will hand out bigger prizes at the end of the summit at 4:45 after the dance performances. And you must be here to get your prize. We encourage you to get tested today and know your status if you don't. We also have a testing den parked right outside that will provide rapid HIV testing all day. And for the first time ever, we have continuing education credits for RNs, LSWs, LCSWs, and chest credits. However, in order to get those credits, make sure before going to workshops that you stop by the registration table on this side. All right? Finally, there are many speakers doing excellent work in the field, both locally and regionally, who have provided us with a suite of workshops unmatched at the Prevention Summit. So good luck choosing. Certificates won't be available until 3:45. I hope you'll stick it out. It should be worth it. And on a final and personal note, I want to say that I have hope. I see an end to the epidemic in my lifetime. There is so much promise and new research coming out, but we need to work together to actively continue to fight for the resources that we need to end the epidemic and make a conscious effort to end the discrimination and stigma around HIV in our local communities. For the first time in over 20 years, the International AIDS Conference will be in the U.S. around July. And I hope to see you all there to make sure that our government knows that we will continue to fight until there is a world without AIDS. Thank you. And great luck.